Hi, my name is Jocelyn Invernon. I'm a PN student at Williston State College, and today for my skills, I'm going to be inserting and removing an NGT. So first, I'm in my med room, and I'm just going to compare my provider's orders and make sure that I have the correct client. So I have Shirley Coast. She's a 54-year-old female, and her date of birth is 5/14/1964. And I'm also going to make sure that all the materials that I have is also for Shirley, so it would be labeled Shirley Coast, 54-year-old female, 5/14/1964, so that matches. And today, it looks like she was admitted to med-surg on 10/14. She has a small bowel obstruction. Right now, she is NPO. We need to do insertion of an NGT for gastric decompression. She already had an ultrasound at bedside of the abdomen, and we need to attach the NGT to low intermittent suction after insertion. So I am going to go ahead and go into my client's room. I've already gathered all the materials that I need, so I guess I can get those out. So we have our NGT, we have our syringe, I have cold ice water, a kidney basin, Littmann paper, I have a tongue depressor and a light, lube, a nose thing, and alcohol, and it looks like I have a safety pin, 4x4 gauze, a med cup, and a towel to protect my client's clothing, and these would be in a glove container. It's just all the way over there. So I'm going to enter my client's room now. So knock knock. Hi Shirley, my name is Jocelyn. Today I'm going to be your nurse. Can I just confirm your name and date of birth, please? Okay, Shirley Coast, 54-year-old female, 5/14/1964. So that matches her wristband and my orders. Perfect. So today it looks like you're here because you have a small bowel obstruction, Shirley. Yeah, not feeling too good. Can you rate your pain on a scale of 1 to 10 for me? Okay, it's a 6. Can you describe it? It's a full feeling? Okay. And where is it exactly at? Okay, in your abdomen. All right, so we're gonna go ahead and we're gonna insert that tube for some decompression and hook you up to some suction. So did the provider already come in and describe the procedure to you? Okay, do you have any questions? No? Okay, so let's just go ahead and establish some signs, since when I'm doing this, you won't be able to really talk. So let's just say a thumbs up is you're tolerating it good, and a thumbs down is you're feeling pain and you need me to stop. Okay, so before we begin, I'm just gonna go ahead and listen to your abdomen here. Okay, so we have hypoactive bowel sounds in all 4 quadrants, and I would have provided privacy for my client before exposing her abdomen, of course. So we are gonna go ahead and I'm gonna remove your pillow, Shirley, and I'm gonna put my client into a high Fowler's position. Okay, so I'm gonna go ahead and perform hand hygiene, and to start, I'm going to measure my NG tube. So in order to do this, I need to measure from my client's tip of the nose to the earlobe, and from the earlobe to the xiphoid process. And I'm going to mark that with a Sharpie here. Okay. I'm going to go ahead and put a covering over your gown, Shirley, just in case you gag enough to spit anything up. And here's a kidney basin as well. And I'm gonna hand you a cold glass of water, and I'll let you know when to drink that. So before I begin, I've already prepared my suction. It is on. I have the tube next to the bedside, and I'm gonna go ahead and put my gloves on. And I'm gonna clean my client's nair as well as occlude one and check which one seems clearest for insertion of my tube. So Shirley, I'm just gonna clean your nose here before we begin. I'm gonna occlude one of your nairs, and you tell me which one feels like you have the most clearest airway. So go ahead and breathe, breathe. Which one felt better? You're right. Okay, so that's where we're gonna go ahead and place that NG tube. So to begin, I'm gonna have you extend your neck. I'm going to make sure that my tube is closed off on the end, just in case any gastric content were to come through. It doesn't get all over my client's bedside. I'm going to coil it in my non-dominant hand. I would open up my lube and I would insert it into my lube 3 to 4 inches at the tip of my NG tube. Okay, Shirley, I'm going to put the tip of this in your right mare. I'm going to have you take a deep breath and I'm going to go ahead and insert on 3. Okay, 1, 2, 3, insert. So my client did gag. I'm going to go ahead and pull back about 1/8 of an inch. Okay, Shirley, go ahead and take some deep breaths for me. If my client were to excessively gag, I would use my pen light and my tongue blade to make sure that there's no coiling at the back of the throat. I'm going to instruct my client to, Shirley, go ahead and sip on some ice water, and every time you swallow, I'm going to advance the tube. So go ahead and swallow, swallow, swallow. Perfect. So that's met the mark of my measurement, so it looks good. So I'm going to go ahead and grab the NG strip, and I'm going to make sure and secure this tube. Okay. I would next also mark the point of insertion if it were different than what I had already measured. So I'm now gonna throw that away. Shirley, do you feel okay? All right, so we're gonna go ahead and I'm gonna aspirate some of your stomach content. So my first check is gonna be aspirating stomach content, and that's just gonna be making sure that it is in the correct place. And once I'm done, I would also call radiology and order an x-ray for a second check that the NG tube is in the correct place. So I'm going to pull aspirate. I would go ahead and plug this, putting that here. I'm going to use a med cup, putting my gastric content in that. I would then dispose of this per procedure policy, whatever facility. I'm going to grab my Littmann strip and I'm going to test the contents. And so it should be in between a 0 and a 4 for stomach content, and that is the correct color it is showing. I would then document the consistency, the amount, and the color of that gastric content and dispose of it. And next I'm going to secure the tube to my client's gown. I'm going to make sure and give enough slack in case my client were to turn her head, it wouldn't pull that tube out or cause any pain. I am then going to use my safety pin. Okay, and then next I would go ahead and hook my tube up to that low intermittent suction, taking this off, hooking it up onto here. Okay, Shirley, I would then give my client's pillow back. I would put her in a comfortable position, whether that would be low or semi-Fowlers. I would gather all of my materials, and then I would document. My client's tolerance to the procedure, the gastric contents, her pain level, where the pain is, the characteristics of the pain, and I would put my bedside rail up, give her her call light, make sure she's comfortable and doesn't need anything before I leave the room. So next procedure, I would be in my med room. I am going to do removal of the NG tube. Now, I would once again check my provider's orders. It is Shirley Coast. She's a 54-year-old female. Date of birth is 5/14/1964. I would make sure that I had the materials in her specific bin, and then I would go ahead and enter her room. So hi Shirley, I'm back. It looks like you tolerated that procedure well. Are you feeling a little bit better? You are. Awesome. So it looks like your provider ordered for us to go ahead and remove that tube since you're doing better. Okay, so first to begin, I would make sure that my provider came in, explained the procedure to my client, and make sure that they don't have any questions. I would then provide privacy, hand hygiene, and get a new pair of gloves. Shirley, can you just confirm your name and date of birth for me? Shirley Coast, 5/14/1964, and that matches her wristband and my order. So I know I have the correct client. So I am going to go ahead and cover my client's gown, put them in a high Fowler's position once again. I would take it off suction, and I would take my suction basin and I would measure the output, document it, the consistency, the amount, and dispose of that per policy for the facility. So I'm going to go ahead and, Shirley, we're going to go ahead and remove this now. I am just going to remove that NG tape from your nose. So I would use like an alcohol swab to help pull that sticky off. Okay, perfect. Okay, I would next use 4x4 gauze as a grip onto my NG tube, and in my non-dominant hand I would have a towel as well. So Shirley, I'm going to go ahead and have you breathe a deep breath and hold it. We're going to pull the tube out on 3. 1, 2, 3. Awesome. I'm going to immediately roll the tube up in that towel and put it in hazardous waste. Right away. I would next just make sure that my client doesn't have any irritation in her nair, on her nose from that tape. Make sure she's feeling good, and then I'm going to reassess her bowel sounds once again. Shirley, I'm just going to take a listen to your bowel sounds. Okay, so it looks like you have bowel sounds are present in all 4 quadrants. So next I would gather all my materials. I would, like I said, take my output, I would measure it, that output in my documentation. I would make sure that my client was comfortable in the right position, give that pillow back, put her in probably a low Fowler's in a comfortable. Make sure she had her call light, she didn't need anything, no questions, no bathroom, and that is removing a NG tube.